Well, it's not about age, it's about an emergency. That's what state lawmakers are saying about a proposal that would allow parents to make certain health care decisions for their adult children during a medical emergency. Our Megan Gagnon has been following that plan since last month. She's live at the State House now. What can you tell us, Megan?
Brian, lawmakers spent most of their time debating Bill 862, which looks at mental health emergencies. Now, the Senate Medical Affairs Subcommittee met last month, but some lawmakers still have some questions.
I do have an amendment.
On Thursday, senators continuing a conversation on a measure that could give parents the legal authority to step in when their adult child is experiencing a mental health crisis.
It's not about the person being 18 and able to make those decisions. It's about the person being 18, 19, 21 and going through an emergency crisis at that moment and mentally could not make those decisions.
Senate Bill 862 would give parents that option, but only under specific circumstances. In the amendment presented by the bill's sponsor, Senator Dion Tedder, a medical doctor would also have to determine the child is temporarily incapacitated and cannot make their own healthcare decisions in a moment of crisis.
And this would really be narrowly tailored to individuals who have a mental health diagnosis, such as schizophrenia, such as bipolar disorder. And so it's again geared to give those parents a tool in those emergency situations that we heard of in subcommittee.
Emergency situations that one mother knows all too well.
We're doing it all for him. We're doing it all because that's what he would want.
During a subcommittee hearing in February, Charleston news anchor Tessa Spencer Burton stood before the medical affairs panel, sharing the tragic story of how her son Julian took his life last July, 1 month and 2 days before his 25th birthday. She says she once took him to the hospital during an active mental health episode, but doctors wouldn't act without his consent, leaving her powerless.
I walked those hospital halls begging for help. I was offered prayers and a hug, but not the authority to save my son.
The proposal is trying to close that gap, putting a time limit on that window and giving doctors legal cover to act when a parent is present and a physician confirms the emergency.
I'm not a lawyer, but I do love the Constitution, and I just think you're going to have a problem taking away someone's rights without the due process. I mean, we do have a process in law where we determine someone is incapable.
This specific piece of legislation perhaps maybe could have changed an instance, could have saved a life of an adult child who was going through an episode.
Tedder tells me he hopes to speak to senators more to address any other concerns that they may have, but he's also encouraging parents that have been through similar crises to reach out to the Senate Medical Affairs Committee to share their story. Now, once again, this bill still remains in the committee, and it is not clear when and if it will reach the Senate floor. In Columbia, I'm Megan Gagnon, Watch Fox News, Local First.